Welcome back to FMR Therapy. JC here, the People's Therapist. And today we are going to work on loosening up the lower leg fascia, right? And we're going to do it on the floor with a ball or two. When I do this, so I can use a foam roller of any size to sort of prop up my leg. I can use a yoga block to sort of prop up my leg. And then we want a ball or something like it. I really like the lacrosse ball or the AccuMobility ball for this because it has some grip to it, a rubbery grip, and it can grip onto your skin. I'm wearing pants today, so we'll just be showing what you would be doing, but you'll be able to kind of see how it can grip because it'll even be gripping my pants and, you know, putting little pleats into my pants. But what we want to do, it doesn't really matter which leg I start on, so let's start on this side here. 2 to 5 minutes a day on each leg when you have a tight Achilles and calf group. There's a lot of different ways to mash this out. This is just going to be one way that I'll demonstrate today. So I'm propping my leg up on this thing, and it's really two reasons, right? Maybe some of you, your leg can't go all the way to the ground, right? So then you kind of need to prop your leg up on something. But also, if I start pushing into my muscle mass right here, it can just leak out onto the other side, right? It's just going around my calf bone. So I'm stopping that muscle by putting something behind it. Then I'm going to take a ball of some kind, and I'm just going to put some pressure right into that muscle. So I've got my tibia bone right here. I've got my calf meat back here, and I'm just right into the calf meat. Doesn't matter if I start down by the ankle or closer to the knee. We'll just go ahead and start down by the ankle. Why not? And I'm just going to put some pressure in there. Then I'm going to move my ankle. So I'm not taking a ball and rolling it around like this. That's not as helpful as doing some contract and relax, right? So I've propped my leg up on something. I've got a ball here. I'm just pressing down behind the bone into the flesh, and then I'm moving my ankle around. We can call this dorsiflexion and plantar flexion if you want to, or you can just say move your foot around. I'm going to move my ball up. I'm going to put a good amount of pressure in there, and I'm going to do it again. Move my ball up, good amount of pressure, do it again, right? So I'm really just pushing down into the tissue. Then, after I get all the way up my leg and just spending some time, maybe 20 to 30 seconds in different spots of just moving that leg around, or in just when you're feeling that it feels a little looser. Now I'm going to take that ball and I'm going to start twisting into the flesh. So I'm going to press down and then twist my ball into the flesh of my calf and really just work on that skin tissue and trying to get the skin tissue and the fascia to get a little bit more fluid running through there. Just kind of loosen up that tissue a little bit. Working my way all the way along the medial side of the calf. How do I do the lateral side or the peroneal side? It's going to be the same thing, but now my ball is on the other side. This is where I like the AccuMobility ball for this because it's flat, right? So now I'm going to put that ball, we're going to be going all along the edge of this side of the muscle meat. I'm going to put that ball right down there. Now I'm going to press down on top, and same thing. Let me move back so you can kind of see this a little bit better. So I'm just pressing down. I've got the ball right in that flesh on the other side of my calf, and I'm doing that exact same thing, and I'm putting pressure from the other side of the leg. And then I'm just moving that ankle back and forth, moving that ankle back and forth, and working my way up and down the leg. How am I going to get my fascial movement? Well, now it's about grabbing my ball and just moving my way down my leg, just kind of, twisting back and forth, grabbing onto that flesh and working on that meat. I'm on the back side of the leg here. While we're at it, we might as well do this on the front side of the leg as well. You've got a nice big piece of meat right here on sort of this outside of the front of your shin bone right over here. So just get on in there. Same thing. We can put some pressure and then move that ankle around, right? Just pressure, move that ankle around, and then twist up and down, up and down. You're going to find that on this front one, as you get closer and closer to the ankle, you might find that there's some zingers or you feel some sensation going down into your foot. Just don't press so hard. Just don't make it uncomfortable, right? So that's how we're going to loosen the lower part of the leg with a ball. If you have a voodoo band or a rubber compression floss band of some sort, this is also a great tool to use to loosen up the fascia of the leg, right? So I can put this thing right around the leg. I can start wherever I want to start. Let's just start down low by the Achilles. I'm not even wrapping all that tight. I'm just, doubling that band over, getting a wrap up the calf. I would do this 2, 3, 4, maybe even 5 times so that I can cover this side of the calf, that side of the calf, whatnot. But now I can grab the entire leg because I've got a nice good grip with that rubber on there, and I can just pull all of the flesh of my leg around that bone this way and around that bone that way, right? I can also just kind of grip and hold and do that ankle flexion that we were talking about, where the band itself is kind of grabbing onto the fascia, and then I'm moving the joint so that I'm sort of stretching the muscles and the fascia underneath that band, if you will. Just also a really great way to loosen up the lower leg, especially if you're having knee pain, ankle pain, foot pain, plantar fasciitis, Achilles issues, any of that kind of stuff. Get those lower legs nice and worked out. Keep them supple every day. Thanks for sticking around. We'll see you next time.